What's going on, everybody? Welcome to the video. Tyler Prue, Valley Behavior Consultation Services. I want to have a little discussion with you all today about goals and goal setting. If you support somebody on the spectrum, what does a good IEP or ISP even look like? And how can you assess if it's a good set of goals that you have for the individual you're supporting? There are foundational things that absolutely must be included in order to develop these goals. One of those things has got to be assessments. You have got to have assessments done by team members, professionals, to try to figure out where exactly the individual that you're supporting is at with many different areas. We're talking about IEPs, we're talking about ISPs. An IEP, of course, is somebody that's school age, so an individualized education plan. If it's an adult, you might have an individualized support plan. These documents and these goals should be well-rounded, and they're going to touch on multiple different areas of their lives. Areas such as communication, health and well-being and diet, behavior reduction, as well as seeing appropriate communication and appropriate behaviors increased. You should see goals in the area of functional living, such as hygiene routines and chore routines, as well as pre-vocational skills, vocational skills, and again, this is dependent on the individual's age. You also want to be looking at, of course, their fine motor skills, their gross motor skills. The assessments that are done should evaluate these things. And another one, which really ties in with communication, but is social skills. That's crucial. You've got all these categories, all these areas of their life you want to have assessed. If you are a team member, or if you have a loved one or family member on the spectrum, and you are going to be attending one of these meetings, you need to hear out what these assessments and evaluations, what the results were. Demand that assessments have been completed and that the goals have come from assessments. There might be some things that others on the team have not seen and therefore maybe have not even thought to evaluate that you're going to want to have assessed or evaluated. So for instance, if you have your child in a school program, or even your adult in a day program, and they're writing an ISP or an IEP, but you're seeing some different things at home than what maybe they see in that setting that they're in, you're going to want to communicate that. And ideally, you're going to want to communicate that during the year, long before the IEP, so it gives them plenty of time to be able to take the time to assess those things. Because there might be some things in the home that you're seeing that they're not seeing. And it might be things that you're seeing that they're doing independently that at, let's say, a day program, they're not doing independently, and vice versa. You know, there are other really important skill areas to assess, such as community living, but keep in mind, wrapped around community living is the area of safety, and safety in parking lots, safety getting in and out of a vehicle. How do they do in a grocery store, picking up their groceries? What aspects are they able to participate in versus which ones do they still need work in when it comes to the grocery store? You know, there's so many complex things regarding grocery shopping. Taking inventory of what is already in the refrigerator and in the pantry. What do I need? Making sure that it's a balanced, appropriate diet of food purchased and kept in those areas for that individual to consume. Taking into account things like allergies, food sensitivities. When you arrive, can the individual navigate a grocery cart without bumping into people? Are they okay with waiting in line? Other things to consider too are they good with budgeting? Do they know how much money they can spend at the grocery store and how much they need to be saving? And then, of course, there's finding the items. Items are not just tossed in the cart. If they're breakable, maybe can't find in the store, and having to seek out somebody to ask where that item is. Or if there's an item missing, do they need to pick an alternative choice? Are they okay with that? And that goes into food selectivity. If they have a significant food selectivity issue where they are only eating a certain brand of a food and they are zero flexibility and they're not eating any other food category, and if it has nothing to do with allergies, it's just all about preference, then that becomes a problem. Because then as they get older, of course, that leads to other medical issues. All that to say that you are making sure assessment is done. You want to know even which assessments were done and what content was in that particular assessment or assessments. If you're just looking for some broad assessments, you certainly could make sure the Vineland is done, that Essential for Living is done, the VB map is done to target more along the lines of communication and then barriers that might be in place. There are so many others. I feel like I shouldn't have even listed out the ones I have because there's so many other ones, especially when they get older, making sure that vocational assessments are done, not only looking at preference, but also looking at skill level and skill deficits and where they need to be with those things. And there's plenty out there. If you have any questions about assessments, please reach out. If you have a certain area you feel like, oh, I really would like my team to assess in this particular area, feel free to reach out to me. I might have some ideas on that. I've done a lot of different assessments. I've been part of a lot of different teams and continue to be part of a lot of different teams to help serve individuals on the spectrum. Also, it is crucial that you've got to, in many assessments, you've got to dig deeper than just gathering the information from the assessments, especially if it's an indirect assessment. So there's a direct assessment and there's an indirect assessment. A direct assessment is that individual, that team member, professional is sitting down with the individual they are serving, and they are right there assessing them on that particular task. They're exposing them to that particular, let's say it's brushing teeth. They want to assess how well that individual does brushing their own teeth. They are going to have that individual's toothbrush, toothpaste, any other supplies that are needed for that task, a bathroom, a sink, all those things, so that they can see which steps are they proficient in and which ones do they still need help in. So that's just an example. So whereas an indirect assessment is an assessment that is done off of information that you have already had or that you already have about that individual just through various observations, through knowing them an extended period of time. So if you've worked with an individual or it's your family member, you probably know them very well and you've seen them in various contexts. You've seen them display or not display many different skills. And so you probably have a good idea when you're filling out an assessment that is indirect, a lot of things. An advantage of an indirect assessment, of course, is you're not having to, let's say, go out to the community to a very particular job location or the grocery store or on a bus to assess how they do with writing. You are just marking on the assessment how you have seen them perform that skill in the past and preferably more recently. But when you're doing an indirect assessment, you're definitely going to want to not only mark accordingly what you feel is best for that particular item that best represents that individual's current skill level in this area, but you're also, if it's going to be a goal, you're going to want to baseline that goal. You're going to want to get very specific with it and actually expose the individual to that particular situation, that environment where they are asked to perform that particular skill. And then you are going to want to take that detailed baseline information and mark it down each and every step. The Vineland, for instance, is an indirect assessment. VB-MAP is typically a direct assessment. You've identified, here are our goals. This is what the assessment is saying. It's indicating that these things should be goals for us. Next, you're gonna wanna make sure that your team or whoever it is that's developing these goals has a very good and solid handle on a scope and sequence for the individual. You want to know, okay, here's the end goal right here. We're starting here because the assessment and baseline told us this is where the individual is at. How are we going to get from here all the way to here? And what happens in between here? A proper scope and sequence will identify every step of the way of how to go about teaching this individual this particular skill. It's crucial for many reasons. It's crucial because, for one thing, you might have this idea in mind where, okay, I want my child to be reading. So that's over here. Now, assessments showed us your child is here, let's say. Well, what skills do they already have that are prereq skills to reading? And then what prereq skills do they still need to display before they can actually fluently read? And you can't skip around. You can't jump from here to here. You can't go from not being able, let's say, to match to reading. I'm picking up reading right now as an example, but that is true for all your goals. Make sure that the individual has a good handle on the scope and sequence of how they're going to teach this particular skill. In other words, how are we going to get from A to Z? How are we going to get there? We're starting here because this is where they're at, but how are we going to get all the way over here? It's not only helpful to know that sequence because you want to know that that team member is competent, but it is also crucial that you know that so that you don't get discouraged. And so that the individual who has that as their goal doesn't get discouraged. It's important that not only the individual that is creating the goal knows exactly what the scope and sequence is, but it's very helpful for any staff that are going to be involved in the training of that individual to accomplish that goal and get there, that they're aware of that scope and sequence as well. That way, they also don't get discouraged. You also want to make sure that just because these assessments that are administered say that these are deficits, doesn't mean we need to work on all of them at once. If you try to work on too many goals at once, you're not going to have time. You're going to get bogged down. It's not only going to overwhelm the team members, it's also going to overwhelm the individual. And there's not going to be a very good direction. There's going to be plenty of time where there's not going to be repetitive enough practice, because accomplishing any goal takes a tremendous amount of practice, and getting really good at anything takes a tremendous amount of practice. So if you have 25 goals, how are you going to possibly accomplish all those goals even in 1 year? It's going to be tough. For most individuals, it's probably not going to be appropriate. Now, are there some individuals where that might be appropriate? It might be. I'm talking in very general terms. I don't know your loved one or the individual you're trying to serve. So I can't speak directly to that, but from my experience, I've seen very focused, 10 goals or less is typically a good, very focused an ISP or IEP. And in some cases, even less than 10. Other things to consider are not only the goals, how you're going to get there, but also how are those individuals, and this is more important when it comes to when you start receiving progress reports. During those progress reports or those meetings, when you're getting updates on the status of how they're doing with these different goals, to make sure that they have a plan in place to fade out the amount of support that they are providing that individual. But you also want to make sure, especially as individuals get older, the support staff are physically removing themselves from the individual's presence, or are significantly further away. Maybe they still are supervising, they still can see the person, to allow the person to individually display the skills necessary for that particular job. If there's not a plan in place to fade prompts and support, you're going to land that person in a dangerous place where they're just stuck, and they're going to have a very difficult time moving forward with their goals. Or it might look like they're moving forward with their goals, and meanwhile, there's a staff person that's sitting directly next to them. That's not independence. The individual that's supporting them should be able to fade themselves out, move away from the individual, and that individual be able to display that skill. So we've talked quite a bit about goal development, and we've talked in quite a broad sense about these things. It is crucial how, though, the goals are written. And you're going to want to make sure that your goals are written in a way that they're very objective and measurable. We want to know how the student or the client or the family member is progressing. How are they doing with that particular goal? There needs to be data collection taken. This team needs to decide, how often are we going to collect data? Are we going to use probe data collection? Are we going to do trial by trial? So every single time we run this particular goal, we are going to be tracking it. Or is it just going to be probe data where it's every once in a while? So that is crucial. You can't have a goal and not have some way of measuring it and measuring the progress or lack of. And which leads me to the next point about goals, and that is, it's also really important that if a goal is not progressing, and if the individual is struggling, that the way in which that particular goal is taught is modified. Decisions need to be made and changes need to occur with how that program is taught. If you are collecting data on the particular program, you're able to see which steps maybe that individual is struggling with, or which areas they're struggling with, which areas they're doing well with and progressing. So let me just say one more thing about assessments. And I know we've already talked quite a bit about assessments, but it is very important to understand and know how sensitive the anchors to that assessment are. Are they sensitive enough to be able to detect significant changes, or really any changes, from the first time the assessment is administered to then the next time? There are assessments, though, that have very sensitive measures. And so you're going to want to make sure that you understand those anchors and you understand how sensitive those anchors are, so that you can make sure that you can detect changes from year to year, or however often those assessments are actually run. Another thing I touched on earlier that's very important is an individual's age when it comes to goal setting. At even a very early age, I think it is my personal opinion that individuals on the spectrum need to learn a lot of independent living skills, even at a very early age. Yes, it's crucial to focus on communication. It's crucial to focus on academics, reading, math, science, and so on, and history. It's also really important at an early age to teach things like preparing a snack, getting dressed, picking out clothes that are appropriate to the temperature of the day or to the activity, showering even, brushing teeth like we talked about earlier. You know, these real basic hygiene routines, teaching them at an early age is very important. When an individual gets to be 12 and 13, you've got to get to the point where they are at least exploring different vocational options. They should be assessed for their preference. They should be assessed for some of the pre-vocational skills that they might already have and that they might need for various tasks and various jobs that they might land later on in life. You're going to want to start very early with exploring their interests, though. Exposure is key, even at the age of 12 and 13 years old. And I know some of you are listening to this and you are saying, I didn't even know what I wanted to do when I was that age. I mean, some of you are like, I didn't even know what I wanted to do when I was in my 20s. I didn't land on what I really wanted to do till I was like 30 something years old. And that's very true with certain people. But also keep in mind that exposure kind of helps you weed out what it is you don't ever want to do. At least you can push those aside and you can take those out of the equation. And that way you can focus on some of these other potential areas. You know, they could be something that maybe the individual you're supporting might enjoy doing. Exploratory phase, whether that's reading about different jobs and vocational things, watching videos about different vocational activities and jobs, going and actually volunteering places is even going to be better. Talking to people about what they like about their job, what they don't like about their job. These are all things that are going to help weed out jobs that are probably not going to be a good fit because the person doesn't show any kind of interest whatsoever. But also, just because somebody acts like they wouldn't like something doesn't necessarily mean they won't like it though either. If you've never done it, you might not know. And try to have an open mind, and hopefully the individual you're serving has somewhat of an open mind about those things. But volunteering is great. Internships are great. And if you live, especially in a small community where there are a lot of small business owners, get to know those people. If, let's say, the individual you're working with loves coffee, which I absolutely love coffee. If they enjoy going to a particular coffee shop, go out of your way as somebody that supports this individual on the spectrum to get to know the staff, get to know especially the owner of that business. If the individual that you are serving is able to socially interact with them, that's even better. Studies have shown those that are most successful on the spectrum in not only landing a job, but keeping a job, it's all about the connections. It's all about them having a good relationship with the business owner or the staff at that particular job. There may be some jobs out there where a business owner is completely open to, allowing for a job coach to be present. You're also going to want to identify, for those that are older, you're going to have that job exploration phase, but then you're going to want, when they're like 15, 16 years old, you're going to want them definitely out in the community volunteering, maybe interning, and maybe it's just a short-term internship, but at least give them some of these experiences. And then as they get older, 16, 17, 18 years old, the focus should be narrower and narrower and narrower when it comes to jobs and when it comes to goals to landing a job. Take some of their skills, take some of their preferences you already know, and maybe come up with a list. And then start going down that list and trialing out some of these things. If they're able to communicate with you a preference, go with it, try it out. So we've talked about a lot of things, and we can get so deep with some of these things. When we talked about communication, let's say, that is so broad. How do they do with requesting their wants and needs? Are they more likely to display aggression or self-injury when they don't get what they want? Or they, instead of communicating appropriately, that's what they do? That's their go-to, is aggression, self-injury, property destruction? Or is their go-to simply asking for those things and being an advocate for themselves? Are they able to, when the people that they're familiar with are not right there with them at all times, is that individual able to find that person and ask them, or go to a novel person potentially, if it's appropriate, and ask them, or maybe somebody they're not quite as familiar with. But they should be able to travel all the way from one room to another room to ask you about something if they need help with something, for instance, rather than engaging in other types of challenging behavior. Other things to consider as well when it comes to communication: do they have an effective form of communication where they are able to express their wants and needs not just to you as, let's say, their caretaker or their family member, or a team member who's been with them for a long time now, who knows them very well and can pick up on what it is they're trying to communicate, but are other people in their environment, such as other family members that might not be quite as familiar with them, able to understand them? If they vocally are speaking and making requests or commenting on things, are other people as listeners able to pick up on what they're saying? That's really important. If not, then work needs to be done in that area. Or is it that they need to supplement their vocal communication with maybe an AAC, so a voice output device? And there's many of those different voice output devices that could be placed on a tablet, usually an iPad, where Proloquo can be used. Proloquo to Go can be downloaded and then can be tailored with the help of a speech and language pathologist and a behavior analyst. Can take a look at that and can help plan what that should look like. Or it might be that that individual needs to rely almost 100% on using that AAC device to communicate their wants and needs. Or it might be that, an AAC is not appropriate for them because maybe they might throw that tablet and destroy it. Well, there are other options. You could use a picture exchange communication book, so a PECS book. And again, if you have professionals on your team, they can help you with setting this up. But an individual can communicate in that way. Also, sign. Maybe sign is appropriate. Maybe that's more appropriate than anything else. So there are ways to assess which one of these modalities of communication are going to be most appropriate. And again, it could be a mixture of maybe even two of these modalities. But an individual who has experience is able to assess these things. And you're going to want to assess, of course, fine motor skills and gross motor skills to know if sign is appropriate. Are approximations going to be appropriate? And I would argue that is really up to the family if they're okay with the approximations. Keep in mind, though, with any modality you choose, you want to make sure that there are opportunities for social interaction, and sometimes sign doesn't allow for as big of an audience. I'm not saying it's not appropriate, but sometimes it can, if the family, let's say, has no interest in learning sign, then that's going to be tough, because there's not going to be any, then who's that individual? Even if they learn sign, who are they going to communicate with then if their family, who they're with all the time, doesn't know sign? So if they're willing to learn sign and that individual is willing to learn sign, then great. And the same thing with PECS, because it's not voice output, it does require a lot of to try to get somebody's attention. You have to teach appropriate space and spatial issues. That individual might need to seek out an individual, tap them on the shoulder, and then use the PECS book to communicate their wants and needs. But it also might be that, especially in a large house, that might not necessarily be appropriate when, if they're in a room and they need something, to go all the way downstairs, let's say, and find you. So there might be some supplemental things that can be done in the home and used so that that person can alert their family members to get their attention, to indicate that there is something that they want to communicate to their family. We've covered a whole lot. These are goals that you are hoping will bring this person to greater independence, to greater happiness, to a better and greater fulfilling life. And so the goals that are selected, you want to very carefully consider. And it might be that instead of just having one meeting where it's official, like an official IEP or an official ISP, you might want to have a meeting before that. Sit down with the team and just listen to the assessment results and have plenty of time to ask questions. And of course, during an ISP or an IEP, there is time to ask questions, but sometimes it can be a little intimidating if you have a very large team. Addendums can happen, so you can absolutely call for an addendum to occur where a goal can get reevaluated and the team can reevaluate if that goal is appropriate or not, or if they need to shift focus, or if their progress of the individual you're serving is moving so quickly, it might be appropriate to add goals at that point in time. Or it might be appropriate to eliminate some goals and put them on hold and just focus on other particular goals. I hope this was helpful, and I'll catch you on the next video. See ya.